This is yoga, meditation, and cannabis as alternative treatments for people diagnosed with bipolar disorder. I'm Esther Shaw. I am a 200-hour registered yoga teacher. So this is a table of contents in case you would like to come back and refer to it at any point in my presentation. So my introduction is titled A Scientific Description of What You Already Know, that bipolar disorder really sucks, and why you should care about alternative treatments. The causes of bipolar symptoms are typically related to circadian rhythm dysfunction. So this can cause lack of sleep and an overactive adrenal response. So this is when your body lives in this fight or flight response that your nervous system possesses. And it means that even when you have tiny little things that happen to you, you might feel triggered. The medical burden of this is quite severe. So you're twice as likely to suffer heart disease and stroke. On average, you'd have 4 times the medical cost. And there are also these chronic cognitive and executive function impairments that follow you around day to day. There are many problems with traditional treatment. So there's a huge caregiver and care seeker power imbalance, which is based in medication compliance. Many psychiatrists require compliance, and if you don't comply, they can either fire you or send you to the hospital. Obviously, this can be quite psychologically traumatizing. Also associated with traditional treatment are huge side effects that are directly related to the medical burden. So extreme weight gain with antipsychotics that can be related to heart disease and stroke, neurocognitive deficits that are associated with antipsychotics, mood stabilizers, anti-anxiety medications, and bone density loss, which is associated with this kind of medication usage over the long term. And in case you haven't been told recently, you're a human being and you deserve to be treated holistically. And there are quite a few alternative treatments your psychiatrist probably didn't tell you about. The 3 treatments evaluated in this presentation are yoga, mindfulness-based cognitive therapy, or also known as MBCT, and cannabis. The criteria of investigation are safety of use in the general population, but specifically in perinatal women. So these are women who are thinking about becoming pregnant or breastfeeding. Reliability of data. So this concerns the scale type used by researchers as well as study design. And efficacy of treatment. So the presence of the all-important positive or negative effect. So what follows is a brief discussion of methods, results, conclusions, recommendations, and finally, references. I used all Keck library databases to perform secondary research. Preference was given to current articles. The 2 research studies included in my report on yoga are Katzman et al. And Doria et al. Neither, unfortunately, included information on participant safety. So I went ahead and included information from Desi Kachar's The Heart of Yoga, written in 1995, which is an excellent book, by the way. And Desi Kachar is a renowned yoga therapist. He says, as long as yoga is done with modifications to the individual, it is perfectly safe. As far as reliability of data and study design goes, Katzman and al. Was an open-label study with a small sample size. Pre- and post-test analysis was used of observer and self-reporting scales. Doria et al. Was an open-label study consisting of 5 course sessions with a small sample size. It lasted 12 months. Pre- and post-test analysis of observer and self-reported scales. Both showed efficacy. Katzman et al. Demonstrated a statistically significant reduction of scores on 2 self-report anxiety measure scales, while Doria et al. Showed statistically significant reductions in scores on depression and anxiety measures. Desi Kachar proves the efficacy of yoga in India by being recognized by India's Department of Health. As far as mindfulness-based cognitive therapy goes, the same pattern repeats for safety. Neither study, Perrick et al. Or Milkowitz et al. Included safety of participants in their article. Again, I included Desikachar's The Heart of Yoga as a source for meditation safety, and he says that as long as yoga and meditation are done with modifications to the individual, they are perfectly safe practices. As far as reliability goes, Perrick et al. Was a 12-month mindfulness-based cognitive therapy randomized control trial. Researchers were double-blind at pre- and post-test, which were observer and self-report based. Milkowitz et al. Was an 8-week program with perinatal women. It was open label. It was characterized by a small sample size and high dropout rate. As far as efficacy goes, Perrick et al. Demonstrated the efficacy of MBCT at lowering anxiety and achievement scales. So achievement is kind of a strange title for a scale, but basically it means that participants over the course of treatment became less hard on themselves. So they became easier on themselves. Milkowitz et al. Showed an improved mindful tendency in perinatal bipolar participants. And Desikachar again demonstrates the efficacy of yoga daily and is recognized by India's Department of Health. Results for cannabis showed again that researchers did not include in their research write-up information on participant safety. So I went ahead and I looked up an article on the safety of cannabis for perinatal women. I found one written by general practitioner Emily Baines, who stated that cannabis disrupts levels of anandamine in early pregnancy, which can cause miscarriage or ectopic pregnancy. As far as the study design of each article included in this presentation, Braga et al. Did a battery of psychological testing as well as included 9+ years of medical history on each participant, and then had each participant undergo a neurocognitive battery just 1 week later. Tyler et al. Utilized an experience sampling method. So study participants had a standardized journal entry that they responded to after hearing a buzzer within 20 minutes. As far as efficacy goes, Braga et al. Demonstrated that bipolar participants diagnosed with cannabis use disorder outperformed cannabis-free bipolar diagnosed participants at a significant rate on 4 different neurocognitive measures, including verbal learning and memory, which researchers have noted is the most robust indicator of bipolar disorder in an individual. Tyler et al. Showed that the relationship of cannabis to mood is variable and promotes positive effect. So as far as conclusions go, under criteria, we see that yoga and meditation are the safest and that cannabis is the riskiest alternative. And this is because it can cause miscarriage or ectopic pregnancy and because it's not legal or medical everywhere. As far as reliability of data goes, yoga studies featured moderately strong experimental design. MBCT studies featured moderate to strong experimental design, and cannabis studies featured strong experimental design. All 3 treatments were found to be effective at treating some scale for bipolar disorder. So yoga was found to be effective at decreasing anxiety and depression. Mindfulness-based cognitive therapy was found to be effective at decreasing anxiety, depression, emotional coping, and achievement scales. And cannabis was found to be effective at increasing neurocognitive measures. So if you're looking to start a yoga and meditation practice, first I recommend that you think about, any safety concerns that you might have. And then also, think about how you want to treat your practice. So if you're feeling, very up, you definitely don't want to do a super energizing workout style practice of yoga. So if you have safety concerns, you can always refer to Figure 11, how to practice yoga safely. And if you're seeking balance, you can refer to Figure 12, recommendations for balancing mood with yoga and meditation. So how to begin a yoga and meditation practice? Well, you can Google local studios, teachers, and yoga therapists. I recommend practicing daily, practicing with others, and always listening to your inner teacher. You can pay for practice by, getting an unlimited membership to a studio. This will save on the price of individual classes. Many studios have work trade systems in which you perform, light janitorial duties for class. You can always barter with any unique skills that you have, and then there are free classes online on YouTube. As far as cannabis goes, if you're living in a non-legal, non-medical state, cannabis is not recommended. You don't need any issues with the police on top of anything else that you're already dealing with. And of course, if you're pregnant or nursing, cannabis is not recommended. So if you did want to implement cannabis as a treatment in your life, and you were living in a legal state, you could do a Google search for smoke shops. Membership might be required. Use as needed, and edibles are probably healthier. So if you're living in a medical state, you can talk to your doctor, obtain a medical card, and use only as prescribed. If you feel extra sciencey, you can always keep a record of each strain tried. And how to pay for cannabis. You can check smoke shop sales or grow your own. Additional safety guidelines for yoga and meditation are also kind of known as listening to your inner teacher. So, excuse me, these are common sense, but warm up before stretching. Try beginning postures first. Don't go full out when learning a new posture. Stay away from advanced postures and come out of any posture that feels painful. Focus on smooth and even inhale and exhales. So, specifically, if you're pregnant, avoid inversions like handstand, headstand, or downward dog, closed twists like revolve, triangle, and prone poses like cobra. Rest often. If you have issues with balance, whether because of blood pressure or vertigo, you can use a chair or wall if you're dizzy in standing postures. Don't raise the arms above the head. And of course, take care when transitioning to and from the floor. If you're hyperflexible, draw your limbs into the center line and allow for a soft bend along your joints at all times. If you're inflexible, make smaller movements and use props like blocks or straps to extend your reach. If you don't have any safety concerns, remember to listen to your inner teacher. This is how you prevent future injury. So here are some recommendations on balancing mood with yoga and meditation. Typically, you're going to kind of want to do the opposite of how you feel. So if you're depressed, you're going to want to warm up slowly and then try some sun salutations, back bends, and laterals. Emphasize the inhale. Meditate on the sunrise, a strong tree, or a mountain summit. If anxious, do fewer back bends and do not meditate on the sun. If you're anxious, you can practice balancing postures, laterals, and twists. Focus on slow and even inhales and exhales. Meditate on mountains, a strong tree, a healing moon, or positive self-affirmations, like I feel supported in this space. If you're manic, you're going to want to practice a cooling and refreshing practice like moon salutations, forward folds, hip opening, and seated stretches. Focus on your exhale. Meditate on a cooling shower, a refreshing stream, or a starry sky. If you're anxious, add self-affirmation practices. So thank you all for listening to my talk. I hope you enjoyed it as much as I enjoyed giving it. Again, I'm Esther Shaw, and I'm a 200-hour registered yoga teacher.